All right, so now that we're recording, welcome to the Taking Action for Worker Health and Safety webinar. My name is Katie. I'm with the California Work and Family Coalition. And I'd just like to give all of our presenters and folks who worked on this webinar a chance to introduce themselves as well. So Alejandra.
Hi, my name is Alejandra Domensain, and I work with the Labor Occupational Health Program, which is actually part of the School of Public Health at UC Berkeley. Very happy to be here.
Great, thanks so much. And Maria?
Hi, my name is Maria. I use she, her pronouns, and I'm the community organizer for the Restaurant Opportunity Centers of the Bay.
Wonderful. And Nicole?
Hi, good evening, everyone. My name is Nicole Marquez, she, her pronouns. I'm the Director of Policy and Legal Services for WorkSafe. Thank you.
Amanda?
Hi, my name is Amanda, and I use she, her pronouns, and I'm an organizer at ACLU of Northern California in San Francisco.
Great. And Charlotte?
Hi everyone, my name is Charlotte. I'm the Education and Training Manager for the California Work and Family Coalition.
And I just want to acknowledge and thank our interpreters again, Andreina and Gilma. We're so grateful to have you with us today. And with that, I will turn it over to Alejandra.
Thank you, Katie. All right, so we are actually going to get started. If we can go to the next slide, please. I'm going to start with just a few public health updates because, as you know, this coronavirus is a new disease, and so we're learning new things all the time about how things work, and what we learn has implications for how we protect workers. So just to give you a big picture, we're now at over 20 million cases worldwide. 5 million of those are in the US. And these numbers are probably, severe undercounts because a lot of cases go undetected. And the US has been hit very hard in terms of deaths. So the US has only 4% of the world's population, but we have 25% of the deaths. So 1 out of 4 deaths is happening here in the US. So what are some of the things we're learning? If we can go to the next slide, please. Okay, so these are the things that I'm going to talk about. These are the 5 topics that we're going to cover and just give quick updates. Just so that you know where we're going. In case you have questions, you can start thinking about what your questions are. And please feel free to put them in the chat. All right, next slide, please. Okay, so we've known from the beginning that this virus spreads through droplets. So if you're within about 6 feet or so of an infected person, these droplets are larger and heavier, and they're going to fall to the ground because of gravity. So only if you're close enough to an infected person for them to land on you, then you are at risk. But now there is more and more evidence showing that infection can also happen through much smaller particles that can stay in the air for a while. So to give you an idea of how small these particles are, if you see on the diagram, there's kind of the dark circle, that's the width of a human hair. And you could fit, maybe 20 of these particles just in the width of a human hair. So even if you're far away from someone who's infected, you could still be exposed that way. So you might be wondering, well, how long can the particles stay in the air? So it depends on many factors. So obviously, like how much virus the person is shedding. Shedding is a word for basically like putting out into the world. And then what they're doing. So for example, if you're just breathing, then you're shedding less than if you're talking, which is less than if you're singing, and less than if you're coughing or sneezing. And then if you're indoors, it depends on ventilation, airflow, air filtration, also the size of the room, how many people are in there. So obviously, if you're in a small room with a lot of people, you have a greater risk. So that leads us to the next slide, which is how important we're realizing that ventilation and air filtration is. So, in this picture, what you can see is, there's a person in the room and they're, maybe coughing or sneezing, and you can see the little particles that the person is shedding. And so some of the things that might mitigate that exposure are the open window, right, which lets in fresh air. Also, if you have a ventilation system that's kind of sucking it up. And then if you have a good filtration system that cleans that air before it goes back into the room. And obviously, the better the quality of these systems, the better the quality of the air. The link at the bottom of the slide has some resources in case you're interested in more details of like, how much filtration do we need? What kind of air filter? But for workers, it's something that they should definitely be asking employers, right? What is their plan? What is their program to keep the air clean?
So Alejandra, if I can ask you a question, if that's okay, or do you want me to ask you?
Yeah, absolutely. Yeah, thanks, Nicole.
Nicole, wanted to know a little bit more about how an employer would get information about how to improve ventilation and air filtration.
Yeah, that's a really great question because, it can be a little bit technical. And so luckily, the EPA, the Environmental Protection Agency, regulates that. And so they have a lot of details about, how many air changes per hour, that kind of thing, like what is needed to keep workers safe. And I think that link that's on the slide is a good place to start. If you guys have more questions about researchers on that, please, we can get you some after the webinar. Thank you.
And then just one more question about how kind of the amount of time we know that air particles stay in the air. Do we know how long airborne particles stay in the air?
Yeah, so it'll depend on the situation, right? It could be with good ventilation that they're out of the air fairly quickly, or if you have a lot of people in a small space with no filtration and ventilation, then it might be there for a few hours. Yeah, those are great questions. Thank you.
Thanks.
Okay, let's go to the next slide, please. All right, so the other thing that we're learning is that, whether the importance of cleaning surfaces and what that is. So, it's definitely still recommended that you clean surfaces, but I think what you have to think about is if that's all you're doing, it might not be enough. So for example, this picture is from a fitness chain that is advertising that it's COVID ready because they're doing a lot of cleaning. So if you have a lot of people indoors breathing heavily, for example, if you're doing cleaning of surfaces, it's probably not enough, right? So cleaning is important, but it's not enough if you're not dealing with the other risk factors, right? You can't just rely on cleaning surfaces.
Had another question for you, Alejandra. So the CDC has always said that surface transmission is not the main way the virus spreads. Do they know, how do they know that?
Yeah, so there's research, there's definitely not enough, but from what we know that it's possible to transmit the virus by surfaces, and especially in places where there's lots of people that are touching the same surfaces over and over, like right after each other. But there aren't that many documented cases where that's actually happened, and the reason is that a lot of things have to line up for that to happen. So first of all, the person that's shedding the virus has to put like a big amount of virus on the surface, right? So it could be that it's not a lot. If it's a lot, then it kind of has to stay viable, right? Because once the virus is outside the body, it starts breaking down. It can't reproduce on its own. So then it has to kind of stay alive. And then someone else has to come pretty quickly and touch it. And then they have to get a big amount in their hands. And then they have to very quickly, touch their eyes or their nose or their mouth, because it doesn't do anything on your skin, right? The only danger is when you touch your mucous membrane. And then you have to get enough of the virus in one of those three places, and then that has to be enough to make you sick. So as you can tell, there's just a lot of times that, surface transmission is not going to happen because all those things aren't going to line up. Okay, so maybe let's go to the next slide. All right, so the other thing that we're learning is, I think in the beginning there was this rush to just disinfect everything, everywhere, all the time. And actually comes at a cost, and it comes at a cost to people's health, especially those that are doing the cleaning or that are exposed. So a lot of the chemicals that are used for cleaning and disinfecting can have really harmful short-term effects. Maybe someone having a asthma attack would be an example, but also long-term effects. Some of these chemicals, for example, can cause damage to the reproductive system. So what the CDC says is that just regular cleaning is enough for most surfaces, just soap and water. That kills 99% of the germs. So really the only places that need disinfecting are really high traffic, high touch surfaces. So it's really important to, not go crazy with it, to really just focus on what's needed for disinfecting.
A question on that, Alejandra. Are there products that get rid of the virus but are also safe for humans?
Yeah, and that's actually really good news in all of this, is that, some products are actually safe for humans, but also effective for the virus. So it's not a trade-off. And the EPA has approved, some of these products. And at the bottom of the slide, I put a link to more information on, which products to avoid and which ones to use instead. All right, let's go to the next slide. All right, so masks. There's been a lot of talk about masks. We know that they're a very important public health measure. We know that they're very important to protect workers, right? When you wear a mask, you're protecting your coworkers, your customers, the public, and of course, your community. And even if, cloth mask does not block all of the smaller particles, just reducing the quantity is helpful. However, let's remember that a cloth mask is not personal protective equipment or PPE for workers. So if you're a worker who's exposed to the virus, you need an actual respirator that's proven to keep out the virus at least 95% or more, right? So like an N95 mask or above. You need more than a cloth mask if you are at risk.
Question on that, Alejandra. For cloth masks, I know there's a wide range, and some products, some protect more than others. How do you know if your mask is protecting you?
Yeah, so you're right. There is a very wide range. The more tightly woven the fabric is, the better. And so an easy way to see that is just like hold it up to the light, and you can see how well the light comes through. If it's a tighter weave or a looser weave. And 2 layers are better than 1. If you can have a filter, that helps. And also the fit is really important. So it should cup well around your nose and mouth. If you breathe in and out and you can see like the sides of the mask kind of going in and out, that's a good sign, because that means the air is actually going through the mask as opposed to just like, leaking out of the gaps in the sides. And then just remember to also keep it clean, obviously. I have another link on this slide that's a really good roundup of just all the good tips for wearing masks as well. Okay, let's go to our last public health topic, which is what is happening with vaccines. So you may have heard that there's a lot of vaccines that are in the trial stage. So that's to make sure that it's effective, but also it's safe for most people. And the other thing is that they need to be approved, right, before they're used. And there's a lot of unknown. It's unclear when there's going to be enough doses for all the people that want it. It's not clear if there's going to be enough supplies, such as the little bottles and the syringes. If we can go to the next slide. The other thing that's not clear is what will the cost be and who is covering it. It's not clear how distribution will work, right? Will some groups be prioritized over others? It's not clear if that will lead to herd immunity, because some people may not be able to get it or will choose not to get it. And it's also unclear how effective it will be. Some people may still get COVID with it, or your protection might just last a few months. We're not sure.
One question on that, Alejandra. What are the steps for approving a vaccine?
So typically companies go through 3 phases. So phase 1 is very small with just, a small group of people. Phase 2 might be with hundreds of people. And then phase 3 is with thousands. And then each country looks at the results of those tests and decides when to approve it. So you may have heard, for example, that Russia has just approved a vaccine, even though it hasn't gone through the phase 3 trials. And so, you know, there's the risks associated with that. So it'll be really interesting to see in our case for the US, which one is approved and, you know, and at which stage. Because, for example, the FDA has said in the past that it'll approve a vaccine that is, you know, 50% effective and safe for people. So that means like, you know, maybe half the people could get side effects and yet it's approved. So you should pay attention to what the criteria is when a vaccine is actually approved. All right, I think I'm going to pass it on to Nicole.
Great, thank you, Alejandra. Hi, everyone. So I'll be covering our major occupational health and safety rights. Next slide, please. When we talk about kind of health and safety rights, we talk about them in these kind of these 3 buckets. And what I'd like to do is talk about a real life scenario, a case study that happened out in the Santa Maria, Southern California area, and go over these 3 buckets, which are the right to know, the right to protection, and the right to take action. And next slide, please. So those are all under this umbrella of occupational safety and health, really looking at kind of the core part of occupational safety and health laws are looking at prevention and how you can prevent or reduce kind of exposure to hazards and other kind of risks that are involved in all of the type of work that we're doing. So next slide, please. On May 5th, 2020, so just not too long ago, there was a group of non-union farm workers out in Santa Maria. They went on strike at the Rancho Laguna Farms, and that's a supplier of the strawberry distributor of Driscoll's to demand fair pay and safer working conditions. Instead of those demands being met, workers were fired. They had the sheriff called on them, and that also...
Oh, sorry. No, somebody in the chat said they can't hear Luis, and I think it might be an interpretation issue.
Sí. Andreina, can you hear me? But can you hear Luis? Luis, ¿puedes escuchar a Andreina?
Sí, sí, les escucho. Ahora sí.
¿Ahora se puede escuchar Adriana o...?
Sí.
Okay. So instead of those demands being met, workers were fired and they had these retaliatory actions taken against them. The workers organized an online petition and delivered it to Driscoll's, the parent company, to address the mistreatment of the workers at their supplier. And so I want to talk about these kind of the rights that are kind of coming into play here at that workplace setting, with the right to know, starting with the right to know, and then moving on to right to protection and right to act. So the first part is about the right to know. Workers in this at the Rancho Laguna site were not being given information about kind of how their employer had set up training around identifying where risks of COVID-19 would appear. Next slide. And they would also look at kind of the not having kind of the information about where what kind of protocols were in place when someone was exposed to COVID-19. There's also a lot of information that was not being shared in terms of where workers could find out about an employer's plan. And so as of July 1, a very important worker right was established, which allows for a worker and their representative to request a copy of what is called the Injury and Illness Prevention Plan. Every employer is supposed to have an injury and illness prevention plan. And as of July 1, you are able to ask for a copy of that. And this is really helpful to be able to verify what kind of plan your employer has.
Nicole, I have a question for you.
Sure.
This is something I hear a lot from workers is, does the employer need to notify others who was infected? Isn't that like a violation of worker privacy? Because the other workers have a right to know if they were exposed, but then that worker has a right to have privacy.
Absolutely. So the employer needs to set up a system of communication if you've been exposed. They're not required to reveal the very specific identity of the person, but if you have worked with that person, then they're required to give you notification of what that you have been exposed, and also have like proper protocol so that way you can come forward if you have been exposed. The CDC also recommends that employers inform employees of their possible exposure, right, to COVID, and really maintaining confidentiality. There can be some kind of interesting kind of interplays, or the way the Americans with Disabilities Act really protects kind of confidential medical information. If an employee is requesting an accommodation or sick leave, and so it's important that that information obviously remains private, but they can disclose it to a public health agency, the employer. But as far as the specific identity, an employer is not required to reveal that.
Got it. And what about, you know, how we were talking about the toxic chemicals that are being used for cleaning and disinfecting now? Do workers have a right to know what they're being exposed to?
Yes, absolutely. So even pre-COVID, you have, you have a lot workers using a lot more kind of disinfecting products that are real abrasive. And so the hazard communication standard requires that an employer set up a plan around how they're going to train workers on how to properly use those new products, what type of we call them controls. So if there needs to be more ventilation, if there needs to be, periods of time where you're not using that product, so you're taking a break from using it, those kind of things need to be communicated to the worker, and there also need to be labels on those products, so that way folks know kind of what the health consequences are, and what type of equipment they need to use to protect themselves. So moving on to slide 18, where we're talking about the right to know. The right to know is really about you, again, getting information about your workplace situation. And so in the Rancho Laguna situation, the workers had already been kind of working at the beginning of COVID with a lot of staggered shifts and kind of social distancing. And then slowly that stopped being enforced. Masks were not being provided. Social distancing was ignored. This also really made it the way in which workers' pay structure is worked out, that they're working by piece rate, by the box. It was making it difficult for people to social distance because they wanted to be able to get as much as you can, so that way you're able to earn as much as you're possibly able to. So this created a real tension. And this was really, that was something that was that needed to be addressed in terms of how a worker can get information about what their employer is required to do when they have a hazard such as COVID-19, and that kind of how it then how your work is structured needs to be reevaluated, right? And now moving on to slide 19, the right to protection. So the right to protection is really, we think about it in this way of a bullseye. So in the middle of the bullseye is really looking at the elimination of the hazard, and that's where you're going to get the most points. The most effective way is to get rid of the hazard completely. The least effective is really with the on the outside of the bullseye, and that's looking at your personal protective equipment. And the reason it's the least effective is because it really is making the worker change and not the workplace. When we think about what is the most protective, we want to see our workplaces change. We don't want to put the burden on ourselves to make to make that change. It's important, but it's really the least protective. So there are, a couple of things that were in play here with respect to right to protection. In the Rancho Laguna case study, the bathrooms are about 5 minutes away. And so we know that in COVID-19 kind of context, you're going to need to have more time to clean your hands, use the restroom, keep a good hygiene. And so this became a conflict, right, when workers were having to walk 12 to 15 minutes to use the restroom, and then also get back to their work to be able to keep up with the piece rate, to keep up with the amount of strawberries that they were required to pick per box, right? Again, this is that's looking at kind of like the structure of the and if you are given personal protective equipment such as a respirator or other kinds of personal protective equipment, as like a shield, the employer is required to pay for it.
Nicole, can I ask you a question too? Because what I see a
Sure.
lot is employers will just like give out masks. And as you said, that's kind of the least protective thing you can do. So is there any legal obligation that they do more?
That's a great question, Alejandra. So, I'll talk a little bit about kind of where the laws are right in for Cal OSHA in terms of the frustration around how it is really guidance. And so when you have laws that are really like focused on prevention, my argument would be is that if an employer did an assessment, they would recognize that changing the structure of your work or administrative controls should be feasible and should be required. We know that a lot of employers kind of push back, especially now with kind of the lack of respirators or N95s for medical staff. And so I think, a creative way to kind of like push back on that would be, okay, well then let's look at ways how we can change the structure of how our work is being done, giving people more breaks, giving people places where they can take a cool down break in an air conditioned, air filtrated setting, making sure people have staggered shifts, and then also not penalizing people, and then access to paid sick days and access to our other kind of social insurance kind of safety net. Next slide. So now we're on slide 20, and this is really about kind of the protection from exposures. I think that these are good examples of kind of like when you're looking at the personal protective equipment that a worker would get. We're looking at kind of, again, these are the types of personal protective equipment that is going to create a barrier between you and the hazard. It doesn't quite eliminate the hazard. It's important, and an employer should be an employer is required to provide that baseline, but these are, again, just examples of kind of where, where an employer can really make sure that they're doing the baseline and going above that. So next slide, please. In the Rancho Laguna case study, we have this bucket of right to know, right to protection, and right to take action. And that is really about workers taking action for their own workplace and demanding dignity and demanding that changes be made. In the right to take action under Cal OSHA, you have the right to file a Cal OSHA complaint. You have the right to refuse unsafe work, which I'll talk a little bit more about. The workers here, they actually used a very interesting kind of organizing strategy with an online petition, and organized themselves to demand and improve the health and safety conditions. And so I'll talk a little bit about, next slide, please, what your, slide 23, what your rights are in terms of enforcing your health and safety rights. So enforcing your right to know, your right to protection, and your right to take action. So
Nicole, could you also say, because I know even though retaliation is illegal, it's something that happens very often. So if it does happen, what could a worker do?
Yeah, so it's really important that workers kind of like make sure that they're taking inventory, keeping a timeline of everything that has happened. Because what we're hearing a lot of is that, oh, it's not retaliatory action because we're no longer having people come to work because of COVID, right? And so, but it was actually related to the complaint that you made to the supervisor about not having the social distancing being adhered, right? So I think that that's really important for workers to know. Also feel like it's really important for workers to know that there is they have a timeline by which they need to file a retaliation complaint with the Labor Commissioner's office. I think, if there is retaliation, it's really important to make sure that you understand kind of the different kind of pots of law. And you don't necessarily have to understand that specifically, but having advocates in other kind of that know that area of the law and that can serve as conduits to be able to really make sure that all of the actions that you can take are being taken. Health and safety based retaliation is against the law, and I'll talk a little bit more about kind of enforcing those rights when we get down to protection from discrimination. So if we go to slide 24, regulations and standards, these are just some examples of the standards that Cal OSHA enforces. You'll see there are quite a few. The IIPP, Injury and Illness Prevention Program, the Aerosol Transmissible Disease Standard. This applies to medical fields and folks in kind of adjacent fields that are at higher risk. Sanitation and general industry safety orders around kind of access to restrooms and general sanitation. Next slide, please. Slide 24. Slide 25. And then we have control of harmful exposures, personal protective equipment, which I talked about, and the hazard communication standard. So these are all standards that Cal OSHA enforces. You may be aware that Cal OSHA, next slide, slide 26, has issued a number of kind of industry guidelines of what they expect from employers during this time. And so the difficult part about a guideline is that we have, we have laws, and then we have the agency that says this is employer how you're supposed to be interpreting and enforcing, adopting these kind of practices. The hard part is that for Cal OSHA to enforce them, it's becoming quite challenging. And so I will there's the next couple of slides are about kind of the industry guidelines for COVID-19 and what an employer is supposed to do. On slide number 29, if you can go down to slide 29, if an employer is not following those guidelines, you do have a right to file a Cal OSHA complaint. The frustrating part about filing a Cal OSHA complaint is that, as we know, Cal OSHA is a very under-resourced and overwhelmed agency, kind of pre-COVID. And so we really want to make sure that we have really strong Cal OSHA complaints that are being moved forward. We know that Cal OSHA is only kind of prioritizing serious complaints. And so to the extent that you can connect with the folks here that are that can provide you with support on how to really prepare a very strong Cal OSHA complaint. And then I'll just move on to slide 31. We talked a little bit about the safety rights that are protected from discrimination. Really important to know that you have the right to refuse unsafe work, and you can't be retaliated against for refusing that unsafe work. There are really specific kind of steps that you need to take. And there are, I would really encourage folks to reach out to the folks here to understand more about kind of what those specific steps are. If we look at sorry, I'm going through a bunch of them, slide number 35, which is the right to refuse unsafe work. And then slide 36. We really encourage people to not simply refuse or walk off the job. Tell your supervisor that you believe there is a serious hazard. Ask for union representation or ask for a representative, and really offer to do work that is not dangerous. And so there are other things that we really encourage people to do, but really reaching out to a worker center. For the worker centers, I think it's really important that they connect with folks at WorkSafe or folks at LOH, at the Labor Occupational Health Project, to get more information. And then, as I was talking about, over on slide 37, recent actions for the emergency standard to protect workers from COVID-19. I talked a little bit about how it's frustrating because our laws we have guidelines for different industries, but we don't have very specific laws that say, employer, you need to do this in the context of COVID-19. And so the National Lawyers Guild, Employment Committee, and WorkSafe, my organization, petitioned to get that type of standard. And so we're hoping to see that will be, that will move forward, and that will hopefully provide workers with better protections in the future. But in the meantime, if we move to slide 38, looking back at the Rancho Laguna case study, we had workers who were non-union farm workers, mostly immigrant, mostly on different kind of mixed status situations. And they really organized to affirm their rights as workers. They were able to get training for foremen and supervisors, so that way there's better communication about COVID-19 and the protocols that the employer had. They were able to triple the amount of shade so that way workers can properly social distance during breaks. And they were able to increase wages from $1.90 to $2.10 per box of strawberries. And this really impacted not just the workers that organized the online petition, but 600 farm workers. And so, as I had mentioned before, you know, we have these rights that protect you from the you have your health and safety rights, the right to know, right to protection, and right to action. And then you have Cal OSHA as the agency that is charged with enforcing those laws, but is really an agency that is struggling. And until we can get more funding for that agency, and until we can get a very specific law that says, employer, this is what you need to do, then my kind of urging of folks would be that that we really look at kind of organizing workers and looking at how we not only organize workers just for the current kind of crisis, but that we know that workers have always experienced health and safety issues, particularly low-wage workers, immigrant workers, and workers of color. So this is not something brand new, but this is something that we can learn from as an opportunity to really change and restructure the way in which our workplaces are for us, right? And so that leads me to the next part with Alejandra, who will talk about what policies and what we need to demand for in the future.
Thank you, Nicole. So I think what you made really clear is there are a lot of regulations that apply to the workplace. And then there's also very clear public health guidance, right? The CDC is telling employers, this is what you need to do. So why isn't it happening, right? What is the problem? Why are there so many employers that are not protecting workers? And I think it's because you really have to make changes at work, right? You actually need new policies. And there's two challenges to that. Some employers just may not know what to do, like, oh, how does this apply in my industry? How does this apply to my work site? But I think a lot of them, they just want to continue business as usual, right? And the actual real policies that will make a change, they may have to change their business model. It may impact their staffing, their productivity, how they organize their space. So for example, in the example that you gave, Nicole, right, the employer had to provide 3 times as much shade so that the workers could actually be able to space out during their breaks. And so you need changes like that. You need actual policies to make the protections real. So if we go to the next slide, there's actually a 3-minute video that I wanted to show you that lays that out. Like, what are examples of the actual policies that might be needed to actually make the health protections real? So if we could play the video, please. Thank you. So I think, we're all aware that this pandemic has shown us where our systems are weak and broken, but we do have an opportunity to build better ones and actually come out of this stronger. So how do we do that? And what do we do? If we can go to the next slide. All right. So what do we need to do? Lots and lots of things. Let's just talk about a few. Okay, one, we need a wider safety net. So that's paid sick leave, including for preventative quarantine before you get sick, or if you have to care for others. Unemployment, including that you can stay on unemployment if it's just not safe for you to go back to work. And by wider net, I also mean that it needs to be for all workers. So that includes undocumented folks that don't have to be afraid of being a public charge and then not being eligible for benefits, or being eligible but not signing up because they're afraid of someone in their family and their immigration status. That means also people that don't have a formal employee status. So if you're independent contractors, domestic workers, day laborers, all workers. Next, we need equitable healthcare, right? So with the record unemployment levels that we have now, we're seeing this is what happens when people's health insurance depends on their employer, right? You lose it. You lose your job, you lose your insurance. So we also need access to quality healthcare. We know there's huge racial and class disparities in and outcomes, right, in terms of health and who has access to care. Information and transparency. So we need to know how many workers are actually getting exposed and infected in particular workplaces or industries or regions, because then, the last thing is we can actually get resources for those that are most impacted. And, Nicole mentioned this, that there's different outcomes for people of color, for Latinos. They are getting hospitalized and dying at many times the rate of those. People in certain industries are really impacted, like meat packing, farm labor, nursing homes, not to mention, places like jails and, prisons and ICE detention facilities. So let's keep going to the next slide. Other things we need. Actually, oh, sorry, I think we skipped one. If we can go back to slide 43. Thank you. So these are just a couple of examples to show you. That one, thank you. One is the picture that you see here. So this was an example of kind of a innovative model for enforcement, where California actually put together this strike force, and they brought together different agencies to enforce the laws that Nicole was talking about. So not only Cal OSHA, which is charged with this, but others that traditionally aren't involved in workplace enforcement. But because we're in a pandemic, they got brought in. So places like the California Highway Patrol, or alcohol and beverage control, cosmetology. So it's kind of a way to think outside the box and get more people out at the businesses seeing what's going on. And then another example of something that, is new was this strengthening of worker protections in the workers' compensation system. So that's like the employer's insurance that if you get sick or ill at work, it covers you. And so the governor made it easier for essential workers that get COVID to get covered by this insurance. All right, so let's keep going with the what we need. Okay, this is the one that I talked about. You know what I think happened is I think we skipped, or I skipped slide 42. If we can go back to the one that says stronger laws. Thank you. Okay, so stronger laws. So, Nicole was mentioning the limitation of having guidelines. So it has to be actual laws. They have to be based on science, not this language of, well, if feasible. No, if this is what we need, this is what the law is. And, that's a great example that Nicole mentioned about this initiative to get a new Cal OSHA standard to cover workers during COVID. And then, laws aren't good unless you have actual enforcement. So better enforcement, not just more resources, but new models for how to do it. Outreach and education, so that workers actually know what their rights are, right? They know what their employer is supposed to be doing. They know that they have a right to speak up when that's not happening. They know where to file a claim or get support. And protection from retaliation, because you can have the best laws and workers know all about them, but then if you speak up and you get fired, then it's all worthless. So I feel like protection from retaliation is the right that makes all the other rights possible. Okay, so if we can go to the slide that says who. Okay, so who needs to do this? Well, us, a big bunch of us. So public health experts are the ones that keep us updated on what's needed. The occupational safety and health professionals are the ones that take these public health recommendations and then give guidance on, okay, what does this mean for the workplace, for the specific industry or the specific site? And often they're the ones that are also advocating for better protections for workers. Of course, labor leaders, that includes not just unions, but worker centers, community orgs, et cetera. And again, just this emphasis on all workers, especially those that have traditionally been excluded from policymaking. So in the next slide, this is an interesting example too of Los Angeles County just passed an ordinance about setting up these public health councils at work, where workers can really bring up problems, say what's going on, and be protected from retaliation. Next slide, please. How do we do this? A lot of ways. We need research, so we know how people are impacted and why. We need advocacy to get new laws and regulations at all the levels, from local to national. We need collective action. And again, not just informal unions, but just people working together to change things. And I think this is a really important one, is culture change. I mean, I think this could be really profound. So, when we started talking about essential workers, really like what I thought was like, great, finally workers' value and is going to be respected and they're going to be treated well. And it's not the way it's actually been interpreted. It's actually been interpreted as, well, even if your health or your life is at risk, it's essential that we make you work for others' needs, or even for others' convenience and lifestyle. And so we need to shift that. We need to shift from telling workers, put up and shut up because you're lucky to have a job, to employers taking responsibility for creating safe jobs that actually contribute to public health, to social well-being, economic stability, to individuals and communities that are thriving. So I'm going to hand it over to Maria for our small group activity.
So I'll actually be organizing these breakout rooms, but so thank you all for sitting through all the information, and we know that it's a lot of information to take in, and we wanted to give everyone time to break out into groups and share your vision for how we can come out of this pandemic stronger with better protections for workers. Louise can't hear. Andreina, can you hear me still? Louise, can you? Okay, great. So now Louise can hear. Perfect. So now I'm going to put everybody into breakout groups. And Tessa just shared it on the chat. Share your vision for how we can come out of this with stronger protections for workers. And as a group, you could come up with 1 to 2 headlines that you would like to see in the next 6 months. And you'll have about 10 minutes to go into groups, and then we'll bring back to talk together. So I'm going to open the rooms now, and then you should see something pop up for you to join. So those of you who are still in the meeting, if you're able to join the breakout group when you're able to, that'd be great. Everybody who's still in this room, are you having trouble joining the breakout room, or are you just choosing not to join? Okay, great. So thank you for those who shared why you're not joining the breakout rooms. And yeah, feel free to hang out here. And we'll bring everyone back in about 7 minutes. Great, thank you, folks. I think we'll give everyone 30 more seconds to join back in.
And then we'll share your headlines. You can write in the chat the name of the person presenting for your group and the number of your group, and then we can unmute you. One person can share for your favorite headline for the group. So if folks want to do that in the chat right now, just share the name of the person that will be sharing for your group. Or we can call you.
Yeah, Maria, since we're a little bit low on time, maybe would you want to just call on one or two people, or do a couple folks want to volunteer?
Yeah, that sounds good. I don't see everyone's face though, so if people want to volunteer, I can't see. But maybe Arisbeth Cepeda.
Hi. Yeah, we were talking in our group that the main important thing is making conscience on people for the side of the employee and the employer, to educate them and get kind of like the employer do their part, but at the same time get people who train the employees and get kind of an agreement. And we were talking about what the environment is right now, about the fine line between the rights from the employer and the employers to trying to survive in the industries, because some of the areas are really hit. We are especially on the restaurant industry. The where we are right now is a very fine line between employees wanting to stay unemployed because they want the unemployment, and on the other side they want to keep their job. And at the same time, we need to make conscience to educate the employees to really make changes on the workplace and to respect those changes about protecting the employees. And I think it's a very important to educate them and to train them right, and to make them open and transparency on what the rights are, but also like on the side of the employer, what they have to do so we can survive on the industry in making.
Sorry to interrupt, Iris, but so maybe the headline would be like widespread education for workers and employers. Like accessible for all, like, you know, and like the headline would be there will be widespread education and access to
and the culture, I think the culture and environment, because I think there's are the main things, like how everything is integrated into a big picture. Is the education, the culture, and the environment to make up the right environment to survive and make things better.
So, I'm out with my wife, you know, it's been a long time that I've been in you guys' group, but I mean, I've been like a couple years ago. So, so basically, you know, I mean, you know, we're living on the practice right now, what's happening up there, and so these rules and legislation and different departments, like we already talked about OSHA, you know, we talk about, you know, the part unemployment is, you know, and then we talk about the lawyers, we talk about, you know, court, you know, all these things where, you know, might gonna be some kind of disagreement between the employees, and you know, what the actions people would take or not. At the same time, you know, we living in this thing where this virus come into our lives, and, you know, we're not ready, and we try to figure out, you know, what it is, how, you know, how get past it through other people, whatever. And then, you know,
so sorry to interrupt you. Just want to make sure that we have enough time for somebody else to talk about their headline.
So let me land this and finish. So habits, you know, we make a habits. We, you know, we always forget about the human relation because, you know, there's not that tangible. and we like to talk about tangible things, but the intangible, like habits, if we don't change our habits, it's gonna be a battle. And we don't want a battle because we want to kill the industries. So let's go take a step back and, work with the psychology, sociology, and all these things. And, for me, I think this things like, for when, if there's a person, hold on, Alice. If there's a person, if they don't believe, they don't want to listen. If they don't want to listen, they can apply it. So I don't, usually, when I talk to people, first step I want to do, they want to listen. And then if they want to listen, they want to believe it. If they're not going to believe it, then they can apply it. So that had to happen in the jobs everywhere. Otherwise, it's going to become a battle. And that's not good for, for the industries. Yeah.
For anyone. Thank you so much. That's a great insight from both of you. I appreciate it. And just because of the sake of time, I'm just gonna read some of the ones that were shared in the chat. That's okay. So a headline, it's over and paid sick leave benefits for everyone are now permanent. That would be amazing. If you read that in the newspaper tomorrow. Subsidized universal health insurance for everyone. Universal basic income for everyone. That would be amazing. That's hopefully we can work together towards a future where we have all those benefits. So I'm actually the person that's presenting. Charlotte, if you could show our slides. We wanted to, make the connection of these protections, which are super important, like PPE and like other protections that happen in the workplace are definitely, your first line of defense. But your second line of defense is paid sick time and paid family leave. So are they as an essential part of our safety at work? I wanted to kind of dive into that. Could you go on to the next slide? So the way that we view it and the way that my workers have helped me view it is like paid sick days and paid family leave are an extension to the safety guidelines. So after we get sick, after we feel like we're going to get sick, paid sick days and paid family leave can be kind of like our second line of defense. And they can offer another safety net to workers when safety protocols fail or, contract the virus or are feeling sick because whatever other reason, right? And I wanted to just read a quote from the SF Department of Public Health, and it's that paid sick legislation would be a practical and evidence-based public health policy to prevent communicable disease, to enable timely preventive care for ourselves, our children, our elders. So this isn't just something that I'm saying as an advocate. This isn't just something as a worker, because I'm a restaurant worker as well. This is something that is supported by science. This is something that is supported by the public health department here in SF and beyond. To the next slide. So we wanted to tie it back in, one of the policies that we're working on right now as a coalition and our different organizations to help kind of offer more of that safety net for workers is called SB 1383. And to give you a little bit of background, there's something that we have as a family leave program that's a worker funded program that we all pay into, and it's automatically deducted through the state disability insurance program. And right now there's no really job protection. So if you want to take some of this benefit that you pay into, you're not able, you can definitely take it, but you're not guaranteed that you're gonna have your job after you take it. Could you go on to the next slide? So we're proposing with SB 1383 to ensure that when people are taking that leave, their job is protected, and ensure that protected leave for employers with 5 or more employees. And we also want to expand the definition of family to recognize the value of like more diverse and multi-generational families. Because we know California is an extremely diverse place. Many of us don't just live with like, you know, like our children and like the classic like nucleus of a family, right? You can live with uncles, you can live with your grandparents, etc. So we want more people to be included in that definition of family, and we want to provide. There be funds to support small businesses whose employees take leave. So about $1 million to provide. Some help to employers who are offering that access to this protection, to this paid family leave. Next slide. So we are calling on you and anyone you know to call on your assembly members. Right now, we have passed the Senate, and the policy has passed the California Senate, but we're on to the Assembly, and we asking you and everyone you know to ask your assembly members to vote yes on SB 1383, and have a link that we're providing here. We're going to be sharing the slides, as we mentioned before, where you can find your assembly representative, and we have also a short template of what you can say. Obviously, we invite you to speak from the heart and to express why this would be something that should be protected and why you could support this policy. Next slide.
Maria, your internet, I think the audio is cutting a little bit. Is there any way we can try to hear you better?
No.
I know you were having some connection issues.
I will try to just get, like, I just got my phone off Wi-Fi, if that helps.
Okay. Yeah, maybe that'll help.
So sorry, no.
It's okay.
Okay, I'm gonna turn my video off, and that might help, okay?
Yeah. Great, thank you.
Sorry about that, y'all. So we also wanted, I know some of you have been very in tune with what we're doing as a coalition and with our different organizations. I wanted to offer some updates about policy AB 3216. Initially, we were asking to this policy to get an extra line of protection of 10 extra paid sick days. Unfortunately, our legislature was not cool with that. They were taking kind of like the side of the employer, and they were pushing back because of the cost. They brought it down to 3 days, and eventually it actually just took it out altogether. So next slide.
Maria, do you also mind just slowing down a little bit? And I think that'll help us be able to hear you better too, but I think it's better without the video. So thank you for doing that.
Yeah, of course. Thank you for letting me know, because I can't tell.
Yeah, sure.
So, you know, we still strongly believe that we should have strong protections when it comes to paid sick time. Everyone should have access to paid sick time. And we should have more than we have right now, because 3 days is not enough to take care of ourselves, especially during this pandemic that has, you know, a 14-day incubation period. For this virus, and we want to highlight that the U.S. is only one of 3 advanced economies, and you can see, you know, different countries that have different access to paid sick time, and we're one of the only countries out of those countries that does not have any guaranteed paid sick time. We do have stronger protections in California, but it is not enough, as we know, because of, you know, how this virus is acting, and also because, you know, 3 days out of a whole year is not realistic for you to take care of yourself. If you have family members that are sick, we should have more access, more access to paid sick time. Could we go on to the next slide? So what can we do next? So we're here doing one of those things, educating ourselves about our rights, educating yourself about, what paid sick time you have access in your particular city, because it does change by cities. We're lucky in the Bay Area, we have more paid sick days, but in some other cities, you only have access to whatever the state standard is. Connect with local advocates and resources. So, connecting with an organization like ROC, connecting with an organization like the ACLU, and connecting, finding out, perhaps you can reach out to us about what a local organization that can help you understand your rights locally is. Also share these resources. We're going to be sharing these slides and the recording of this training with the people in your network, your coworkers, other people that you work with, other advocates. And for those who are in the workplace, organize your workplace and get resources to organize your workplace from local advocates. And learn about who are your government officials, because we should all be pushing them to do something more than they're doing right now. It's unacceptable that we are not able to extend paid sick time in the middle of a pandemic. And speak to those local government officials, educate yourself about who they are, and then let's get after them. Let's communicate with them and ask them for more. And work with local organizations to help pass local ordinances. So we were lucky here in the city of Oakland, we were able to expand emergency paid sick time for folks, and that is possible in any other city, but we need your help. We need the help of advocates, we need the help of workers, we need people to show why this is important. And we can go on to the next slide. And that is all. I wanted to thank, yeah, go ahead.
Oh, go ahead, Maria.
I just wanted to thank you all for participating today. Everyone who was a trainer and who helped organize this training is an advocate and is a resource for all of you. So I just want you to note that, and to feel free to ask any questions after this. Whatever we don't know, we will let you know that we don't know, or we will find out for you and help you, either help push for local policies, or help you offer you resources for organizing. Amanda.
Thank you, Maria. Yeah, I just wanted to add, we know that this was a lot of information, and Alejandra and Nicole are actually able to stay on a little bit past 6:30 to answer any questions that you might have. But if you don't have any questions, we'll be emailing you later on with a presentation, and would love to follow up with you later. But feel free to stay on if you have questions. Thank you, everybody.
Should we try and answer one question, or are people leaving? What does that think?
Yeah, I think there were a couple people who actually posted questions on the chat, but I think that those people actually might have logged off already. So maybe what I could do is just email these questions to Alejandra and Nicole, and then we could answer them in the follow-up email. Does that work for you all? Okay.
Sure. Yeah.
But does anybody else on the phone or on the Zoom right now have any questions? Beth and Sandra, Camilo, Celine, a couple people who are still on. Okay. Well, I guess we'll assume that nobody has any questions. Maybe people are feeling shy, but definitely, so I'm going to close the Zoom then. But if any questions come up, we'll be following up on email, and so you can feel free to email us, and I'll include everybody's contact information as well.
Thank you so much, Amanda. And thank you, everyone.
Thank you all.
Thank you, everyone.
Take care. Thank you, Gilman,
Take care.
Andreina, Alejandra, Nicole, Maria, everybody for presenting. Thank you. Bye.
Thank you. Gracias a todos.